We are here at the University of Toledo Medical Center. We have Dr. Kelly Manahan with us once again this week, and we're talking today about urogynecology. For people that aren't familiar with that, fill us in about what that is.
Urogynecology deals with pelvic organs that, as women age or have children, may relax or change positions. Women deal with leaky bladders. That's not a very popular topic to discuss around the dinner table, but it is a very, very common problem in our current population as our population ages. And so urogynecologists are specifically trained to be subspecialists in that area to care for leaky bladders or relaxation of the pelvic organs where there's lots of pressure and things may need to be pulled up or hiked up or supported in some way so that they don't have these kinds of pressure or leaking problems.
Now, it's interesting you say it's something that you don't talk about around the dinner table, and it certainly isn't. But do you find that as a doctor, that if the more you talk about these issues, the more you bring them to the forefront, the more you might start seeing people go, yeah, that affects me. I need some help with that.
Oh, absolutely. In fact, we all kind of snicker when we talk about leaky bladders. But after you say that, you do find many women that say, well, to be quite honest, I have those problems, and I don't know where to go to get care for something like that.
Mm-hmm. Is that difficult to get women to, and not just women, any patient in general, to admit to something that might not be very popular to talk about, and then come to you and say, listen, this is affecting me?
It is if we don't talk about it. It's difficult for them to admit it if we don't talk about it. But if we as physicians probe with questions like that and say, are you having problems like this, then patients are much more willing to say, yeah, actually, I am suffering from this.
Now, are you seeing, is it the aging issue of the population, or is it just the way women are eating differently?
There are lots of different theories about what may be contributing to this. Part of it is aging. Part of it has to do with obesity again. Some of it may have to do with childbirth. All of those things are factors that can contribute to leaky bladders or pelvic relaxation.
Okay, and there are some other benign services you're also working with as well in addition to that department.
Yeah, exactly. One of the things that I think is very important for us to stress is that actually here on the University of Toledo Medical Campus we do provide benign OBGYN services, and we have OBGYN doctors who provide obstetric care and GYN care, whether that be in the office or for postmenopausal health, or in the surgery suite for hysterectomy. We provide all of those kinds of services.
Do you feel like that when you're doing these kind of services, that when you have people that specifically focus on women like this, that it's a better level of care because that's their sole dead on focus?
It absolutely is a better level of care. Having that subspecialty representation within the department provides better patient care.
Do you find that women are looking for that more specialized care these days because they know there are so many issues out there, and men as well, but specifically for women, that they know the issues there and they know the care is there?
Absolutely, and we as a university must provide that depth of care across the spectrum to represent all subspecialties. It is something that is very important for us to do as a university.
All right, Dr. Manahan, good insight. We appreciate your time today at the University of Toledo Medical Center, and that's your Talk Back.